All right, so I'm going to start with this question here, and I like it because in today's world, if we want a gallon of milk, a beer, or even toothpaste, we can go to the store and get it right away. Fairly convenient. Have you ever wondered why that's not true for what we might need the most, our prescription medication? Often that means a drive through traffic. It might mean waiting till tomorrow or even Monday, and quite often long lines when you get there. If you don't believe it, ask anybody about their most recent fulfillment experience. It's often not pleasant, and this is a problem that impacts all of us. So I asked this group of innovators, does it really need to be that way? And I'd like to say that I don't think so. Uh, I'm Russell McKee. I'm a founder of VendRx. At the bottom, you can see some of the environments where we can bring the medicine to you where you are right now by leveraging some automation innovation that exists right now and is serving customers right now. So the evolution, or I should say the innovation, is not so much technology, but bringing the medicine to the patient where they are when they need it, not the reverse of sending them off with a prescription to go get their medicine. So drill down on the problem that impacts everybody a little bit. If you're watching the news, you see this happen, might be on a weekly basis. So it's really cost pressures on the pharmacy. People love pharmacy, they love pharmacists, but the cost pressures that impact them is crushing them. So number one, they're closing stores. Number two, in order to reduce a line item, they're losing staff and they're asking more from the staff that they keep. This leads to mistakes. So now, to put a gigantic problem in one box, these inefficiencies all point to cost pressures, inefficiencies in the legacy and antiquated prescription fulfillment model. And that's what we're working on, and it has to happen soon. Uh, Patients get the brunt of it. Over 100 million, this is before the recent uptick in crisis, have a hard time getting to the pharmacy. When there's friction, they don't get their medicines filled. 1 in 3 new prescriptions go unfilled in an ER or coming out of an ER, where most patients come in when pharmacies are closed everywhere. It could be 1 in 2 prescriptions that never get filled. So how are we addressing the problem? VendRx. Let me put it in the words of one of our customers. VendRx is a prescription fulfillment and medication dispensing service that enables convenient, simple, on-demand prescription fulfillment. I would add secure. We can receive a medication immediately, saving you all the hassle of going to the pharmacy. Now is a good time to point out that the equipment that you see to the right is just one of our products, and it's really clear, and something that needs to be really clear that I'll touch on later. Physicians can dispense to their own patients in all but a couple of states. This is different than the process we know, which is going to the pharmacy. The pharmacy, of course, that can do it in the same fashion. We are the only company out there that can serve under both of these jurisdictions, providing a technology for clinics so they can take better care of their patients and also add revenue to their business, and also serve pharmacy in a remote fashion where you can have one pharmacist connected to many systems that are remote to them, serving patients wherever they are. Would you like to see what it looks, how it works and how simple it is? This is a staff member. Okay, I'll pause on that for a second, just to tell you what happened. We did it slow. That takes about 10 or 12 seconds for a full dispense. It automates everything except for what a human needs to do with this product only, and that is put a label to the medicine. A bottle or box, all prepackaged, everything's automated, including replenishment and ordering. Everything happens like this. So the only thing that a busy staff person needs to do during a hectic day is what you just saw. That is a dispense. Really critical that you do not impact workflows in a hectic clinical environment. It'll never take off. What you saw at the end was it asked for another scan. That is redundancy for security to make sure that you don't give the wrong medicine. Give you this can go into any clinic. We've never had a trouble finding a space to put it in, even in small clinics. You can see a happy clinic manager here in LA, where we just put it in Pasadena. I'm moving on to the big product because I'm watching my time and knowing I'm going to be run out here. This is our fully automated flagship product. It is self-serve on demand. You can think of it as Redbox for a pharmacy, except for medicines are never going to be zeros and ones. So we're pretty safe here. To the right, you see just one touch of our IP. We've got multiple patents on this, allowing very great flexibility. Every cell inside a machine can be a unique medication type. You have to have that kind of breadth to serve patients in many environments, particularly in urgent care. In this case, you can have up to 425 different medication types. Patient self-serves. Okay, moving on. Well, why would a clinic want to have this technology? I've illustrated two different use cases. On the left is under the physician jurisdiction. It takes only and don't let the numbers scare you too much. These are the calculations that we have doing in a clinic. And I won't go through all the detail on that, but it tells you how many prescriptions this automation will enable you to fulfill right there, including our costs and costs of medication. A clinic can pay for all of that for 3.5 prescriptions. And we give them a nice little runway to use it. If it doesn't work, we take it back. To the right is a hospital situation. This is a customer up in Washington State. They were only capturing, they don't have outpatient pharmacy. They're only capturing about 1.8 to 2% of their patients in-house. And now we're going in. You can see that it's a very, very low bar to do better than they were doing, not only to take better care of their patients, but they can make quite a bit of money serving their patients better. And you see that number on the bottom. It's the largest healthcare system in Washington State. Simple business model. I call it system as a service as opposed to SaaS as a service. It's a flat monthly fee. Our VendRx product, that's what we call it to the left. They give us a 6-month commitment. We put it in. If it doesn't serve them, we'll come get it, stuck on the wall. They won't even know it's there. And so they either serve patients and make money or give it back to us. Haven't had that happen. We have almost no attrition across all of our products. I'll tell you where we are in the market so in a moment. Big system, quite a bit more to handle more complexity. The reason there's a range there is the 3,000 per month is for a pharmacy. For a physician, we tap into the SureScripts network, no integration required. For pharmacy, we have to do a little bit of work with the pharmacy provider, but we already have finished integration work or nearing finishing integration with Epic to exchange data with the pharmacy to make the end of the dispense function. That's the part that we handle. Okay, we have been very strategic and thoughtful about which customers to land first. On the right, you see some of them. Most of those customers are customers who bought once and then have all bought a lot more. We're up to 15 and growing with Carbon. OnMed has bought 10 fully automated systems, and the list goes down. Some fun things in the funnel, very close on some deals there that you see next in the funnel, and exciting conversations with some very big players to the bottom. Okay, this right here is an implementation projection on current customers, scaling with current customers. It does not include customers that we're just still having a little bit of flirting with. These are real customers. So 2.5 to 3 years out, it's reasonable based on our existing business model and money and revenue we're bringing in per customer to expect around 3 million per quarter toward the end of this. That is without aggressive growth. So our beachhead markets is urgent care primarily. For our small product, we call VendRx, the wall-mountable product. For our big product, it's hospital ER, and we'll go from there. So we're already in lots of other versions of primary care. We're in occupational medicine with 18 clinics of occupational medicine, and we are, and of course, a high need area is mental and behavioral health, and we've got a little bit of work going on there too. These numbers, at least the beachhead market and the all dispensing markets, are based on our current revenue models. It could be much, much bigger than that. We think conservative. I think most people are aware of just how big the prescription drug market is. I want to speak with my remaining time about this product. This allows us to monetize prescriptions that are not filled in-house, We already have a partner, a GoodRx competitor, but it's non-exclusive. So 100% of prescriptions coming out, we could market. We've got relationships building with these, so we can. Okay, we can add OTC medicines. You can read about our resumes online. 2.5 million. You'll get about 15% of ownership, and we have a lot of interesting things that we're going to do with that money. Would love to talk to you more about it. Thank you. Gosh, that time went quickly. Thank you for your attention, and happy to hear questions after.